It's my privilege at this time to introduce our first speaker, and that is the Honorable Anna Eshoo. Congresswoman Anna Eshoo, representing the 18th District, exemplifies innovation. She's creative, boundary-breaking, and productive. She is a problem solver and a consensus builder. In Representative Eshoo's 2 decades in Congress, she has defended consumers, promoted American competitiveness and innovation, fought for access to health care for families and children, protected the environment, and encouraged development of clean energy technology. Representative Eshoo worked consistently, earns the highest approval for a wide range of organizations, including the League of Conservation Voters, the Humane Society, the American Association of University Women, Iraq and Afghanistan Veterans, the Biotechnology Industry Organization, the American College of Emergency Physicians, and the Science Coalition. The San Jose Mercury News named her one of the 10 most powerful women in Silicon Valley because she sits on committees that oversee the internet and biotech, areas vital to the Valley's interests. Underlining Representative Eshoo's tenacity to serve her constituents are her achievements. There are many, but one notable was the tragic loss of 9/11. Representative Eshoo recognized critical gaps in our nation's public safety communication network. As ranking member of the powerful House Communications and Technology Subcommittee, Eshoo was uniquely positioned to address the issue. Working from recommendations made by the 9/11 Commission report, Eshoo led a charge in the House to create America's first nationwide interoperable public safety communications network and to appropriately significant fund this new generation 911. Ladies and gentlemen, it is my honor to introduce the Honorable Anna Eshoo.
Well, good afternoon, everyone. Thank you, Bill, for your all-inclusive introduction. I always wish my children were in the room when I'm being introduced. It was most generous. Thank you to each one of you for being here today, and it's a special treat to have my colleague and dear friend, Congresswoman Jackie Speier, join all of us here in the 18th Congressional District here at the VA in Palo Alto. And I'm delighted that the room is full. We're looking to hear from you. You all know that there are problems that have been uncovered across the country within the system. And I'd like to thank the chaplain for her very special, beautiful prayer. Her prayer really summarized why we are here today. We know that there are problems, and some deep problems, causing veterans and the American people to lose faith in this institution that was established to serve those who don the uniform of our nation. And when every individual dons that uniform, what goes with the uniform is the promise of the American people. The promise of the American people that for the rest of a veteran's life, that they will have the best of care. What I am especially proud of here in Palo Alto are all of the needs that have been met over the years. And I want to call out 3 things that are, or 4, that are a great source of pride to me and I know to you. Not 1, but 2 Fisher houses. And the first one and the first contribution for that Fisher house was made by employees here, taking money out of their own paychecks to help build that kitty that then grew into an amount that the Fisher family said, you've now crossed the line, we will build one, and 2 have been built. The Defenders Lodge, the new mental health facility, which was a long time in coming, but one of the great needs of veterans, especially those returning from Iraq and Afghanistan. So I want to thank the team here, most especially Lisa, who is, because she's so outstanding, is being called to another post, but she's going to return to us. Now, the question across the country, and especially here today, are wait times. We all know that when we need to see a doctor, our bodies are telling us something. And so we want the most efficient, effective system that allows us to see a physician. And so we want to address that issue front and center today. The Congress, the chaplain prayed that the politicians have integrity in what they do. And given what we have found in different places across the country, the Congress has taken up, maybe this is the signal for me to stop talking. The Congress has taken up legislation that not only contains more funding, very specifically for the needs that are there, but also to address some of the specific ills that have that the system that we have learned about the system. So you're not here to hear me make a long speech today. We want to hear from you. And again, I want to thank you, and I want to thank the team that labors here. This is a huge, huge system in our country. In this congressional district, in my congressional district alone, we have 30,000 veterans. 30,000. 30,000 is perhaps larger than some of the communities in this congressional district. And I want to see, and I'm committed to, as is the team here, the absolute best. Why? Because our veterans have earned it with their service to our country. It's a sacred trust. It really is a sacred trust. What do I want to see come out of all of this? Certainly the facts, because once you have the facts, then you can move forward to take care of what is wrong. But I think more than anything else, we come here today with hearts that are not only heavy, but also hearts that are filled with gratitude for those that have served our great country. I have had the privilege of traveling to meet with our those that were in active service, several times to Iraq, several times to Afghanistan. So when they come home, we welcome them with open arms, but also with a place, a safe place that they can trust, where they can get the care that they need and heal. The healing of the body, certainly, and also of the mind as well. So thank you for being here today. It's an honor to be with you, to join Lisa, to join my outstanding colleague, Jackie Speier. We served on the Board of Supervisors in San Mateo County together. She preceded me there by 2 years, so she was the senior member at the board, and then she joined the Congress. She's really one of the most outstanding members of the Congress, one of the most effective members. And I think you all know that because you know her here from home. So is it up to me to introduce Jackie? I can do it. All right, Bill, you can do it. Thank you, everyone. Sure. Okay. Thank you.
Thank you, Congresswoman. I've been told to make this a little bit shorter. Yes. I will. Okay. Congresswoman Jackie Speier has lived her entire life inside California's 14th district, and in April 2008 was elected to represent the district in Congress. Previously, she has served residents in the San Francisco Peninsula while on the San Mateo County Board of Supervisors, and later in the California Assembly, State Assembly, and State Senate. She has a total of 29 years representing public service. Ladies and gentlemen, the Honorable Jackie Speier.
I'm going to stand in front of this because I'm short. And want to first of all say to each and every one of you how grateful Congresswoman Eshoo and I are that you were here. it is our job not only to make sure that the Palo Alto VA Hospital is operating well, but that the hospitals throughout the country are operating well. So we're here on a fact-finding, also to make sure that all the resources that should be here are here. I want to say Congresswoman Eshoo has served over 22 years in the Congress of the United States. I have served a measly 6. So she is my, my senior, and I take great pride in watching her in action and learning from her. I want to say thank you to Bill, thank you to Director Freeman for giving us the opportunity to use the facilities here, and each and every one of you, thank you for taking time to help us sort through this abysmal situation on a national level, but hopefully address the issues here locally in less of an overhaul and more of a fine-tuning. Now, we do know that to get a primary care physician appointment when you are getting your initial appointment takes 45 days. And we should shorten that. It takes 14 days to get an appointment once you have a primary care physician. We do know that the software system used for scheduling appointments here is 30 years old. Now, come on. That's antiquated. And we should do whatever is necessary to make sure that you have an up-to-date system. Primary care physicians is a very high-cost living area here in the Bay Area. What we pay primary care physicians in Iowa and what we pay primary care physicians in the most expensive area in the country should not be the same. And I think one of the things we have to do is create an adjustment for high-cost areas in terms of a pay scale. Now, having said all that, there are probably a number of issues that you would like to see us address, and we're here to hear from you, not to speak to you. So I just want to say thank you for being here. You have our commitment, our full and total commitment that we will fix whatever needs to be fixed. The fact that Director Freeman has been asked to go to one of the hot spots of the problem areas in the country would suggest that we have someone who leads this institution very well. But we also need to make sure that you're getting top-notch access and top-notch quality of care. So hopefully we'll hear more from you for the rest of the hour and a half. Thank you.
Thank you, Congresswoman. This time I'd like to have Congresswoman Eshoo please come forward and introduce our director.
Well, I'm not going to read Lisa's bio. I think that we know Lisa Freeman from the leadership that she has given to this place. As the member who is in constant contact with the Palo Alto VA, and wherever there have been snags, she has been on it like white on rice. She started out as an engineer, imagine that. So now you need to engineer a cure for the entire country, Lisa. And I know that time flies, but it's not going to go by fast enough until we get you back. So it's with a great deal of pleasure, but it's also an honor to work with someone that is a thoroughbred professional. And it's never about Lisa. It's never about Lisa. It's always about the service to those that she has committed to serve in her professional role. So it's with a great deal of pleasure and honor that we present to you the director of the VA here in Palo Alto, Lisa Freeman.
So I always say I wish my mother was here when Congresswoman Eshoo is speaking, but So first of all, this afternoon, I just want to welcome all of the veterans who are here. You are the reason that we exist as a healthcare system. If we can't meet your unique healthcare needs, then we don't need to exist. And I do want to acknowledge right away the issues that have been going on in the VA. And as I was walking down with Congresswoman Eshoo, I said, you know, we really, our mantra here, every day we could be better. Every day we could improve. So I'm looking forward to the comments from you all this afternoon on ways that we can improve. And I want to tell you a little bit about what might be my remedy on something that we've been working on here for the rest of the country on just a whole attitude of improvement that I want to review with you very quickly. And if we could dim the lights a little bit, I'll just walk you through this. So, oh boy. Get my technical person here to help me out. So I'm going to talk with you a little bit about the mantra that we have at the Palo Alto. So how do I? Okay, so this is our strategic pyramid, which of course most importantly has veterans at the top, because we want to be sure that in everything we do, we're focusing on veterans. And then two of the overarching principles that we include in this pyramid are that we are continuously improving, as was discussed, but that we're always doing that with a focus on veterans, and I should add veterans' families. So I also want to say a special thank you to any family members of veterans, because I know that you have sacrificed as well. The other component of the strategic pyramid is that bottom statement of serving those who served. That is our attitude here. Our attitude is always one of service. We have a goal that we would like to have 40% of our staff be veterans. We're a little over halfway there now. A little over 20% of our staff are veterans, so truly veterans serving veterans. This is our service improvement model that has a couple of components to it that I won't go through in detail, but I wanted you to know that we have embarked on a journey of continuous improvement here, and we use this system of our service improvement model as to how we are going to improve every employee, every day, every setting of care, every veteran that we treat, one veteran at a time. And so we do that by respecting people, working together in an optimal way to solve problems, working together through these three components of value streams, goal deployment, and daily management. And one of the key components of this service improvement model is respect. It's respect for all of you. It's respect for each other. It's respect for the good ideas of every employee at every level. We want to move from a culture of compliance, and maybe that's been some of the issue in the VA today, is, you know, coming to work and trying not to mess up versus coming to work brimming with ideas on how I'm going to improve the service that I provide each and every day. And we do that with our veterans, with all of you, with your families, so that it's not that we propose changes and impose those upon you. It's that we work together on how we're going to best improve this system, so that as we're building this house of improvement, we've built it with you already there, and you're already going to be accepting and understanding and embracing how we're going to improve together. This rather busy slide is just meant to depict that our service improvement model touches every employee at every level, so that they're all solving problems with it by what we call our daily management system. This is something that you won't hear about in every VA. If I had my way, every VA in the system would be using a daily management system to have improvement take place every day, to have stability every day, to have predictability in every day, standard work, standard procedures, standard audits, so that some of the things that have happened in other parts of the country, there is a very visible way of knowing what those issues are so that they can be worked on. We have started this here in inpatient medicine and in our emergency department, and if any of you have come through either of those settings, I hope that you've seen some of the changes that your fellow veterans have suggested, so we can shorten waiting times in the emergency department, improve that experience of care in inpatient medicine. All levels of supervision are practicing daily management system. We will have all of our major services have gone through our service improvement model and learning how to use this daily management system by the end of this fiscal year. And that is an attitude of improvement that we are spreading to all employees every day. So in thinking about our service improvement model, all of these ideas, and the one I really want to key on is this idea of true engagement. You know, nothing angers me more as a public servant of 31 years than good enough for government work. I mean, I want good enough for government work. I heard that. I have never come to work without thinking of how I could do my job better. And I think that's a widely held belief in government service. And that we want to promulgate, we want to very publicly advertise that that is the way business is done in the Palo Alto healthcare system. It's not a change that occurs overnight. And I think that's another theme of we're going to hear a lot of suggestions today for improvement, which we will embrace. And I do ask for your patience in the time that it will take, because these improvement journeys are not 1 to 2 year fixes. They're not the cycle of any one administration. They're 5 to 10 to 15 to 20 year journeys. We're in about year 6 here in the Palo Alto healthcare system, and I'm very confident that whoever is at the helm here, in the short term and in the longer term, that we will be on our way. I'm going to take just 1 more minute, though, to just comment specifically on wait times in the Palo Alto healthcare system. So this entire issue of wait times, what we're asked to identify in the Accelerating Care Initiative is, did we have any groups of veterans in groups of more than 20 who were on what's called an electronic wait list? We put veterans on an electronic wait list if they're having to wait more than 90 days for care. So when that call first came out in May, we had 2 groups where we had veterans on that list. That was in neurosurgery and in dental. And I'm proud to say the entire neurosurgery backlog has been worked down to where we have no veterans on that list now. In dental, we started with over 200 veterans on that electronic wait list. And the number that we have yet to contact today is actually 0. We've attempted to contact every one of those veterans. We still have under 70 who are either planning to be seen by outside VA care in our clinics during normal times or weekends or evenings, and then about 20 of those 70 whom we have yet to reach, and a number of those veterans are homeless, so they are often difficult to reach. But I want to stop talking. I want to hear from all of you, and I just want you to know that we are all here in the Palo Alto healthcare system with our fabulous congressional delegation that's here today supporting us, here to serve you. Thanks very much.
I didn't fill out a card because I can't write. I just wanted to tell you about an experience I had here. I had some surprise surgery, and when I came out I was unconscious, and they were tying me up, and my wife said that they weren't allowed to tie me up, and that they should hold my hands. And they said, these guys should be grateful we're here to take care of them. And my wife turned to them and said, do you see this wonderful country you have? These men bought it for you and paid for it with their lives. You should be thankful you can care for them. Where's she at? She was right there. Somebody stole my wife. She's hiding someplace.
My ex.
This is the attitude. This is the attitude I run into here. I had to wait 13 months to get an appointment. I would phone. They would say, we'll call you when we want to see you. I've come in. Right now I'm on 2 antibiotics and a steroid. I had to go to an outside doctor to get them. I couldn't get them here. I couldn't get treatment. And I've asked the VA hospital to quit using anagrams. I don't know what they mean. I know the VA means Veterans Administration. I know what snafu means. Yeah? So please stop the anagrams. If I have an appointment in some building, put the name of the building down. Don't put down the little initials for it, because I really don't know what it means. And I can go on for a long time about this. I have a whole list here. And this is a letter I sent to Ann Eshoo many years ago. My copy's turned yellow. Okay?
Thank you, sir.
I think he was trying to say acronym.
One.
My name is Bill Kaiser, and I just want to say that I consider the entire VA PHCS is a shining example of what the VA system should be. And I'm just so fortunate that my wife is a World War II veteran. I'm so proud of her. And the fact that she's 89 years old and she's alive today because of the wonderful care that she's gotten in this facility. I just want to thank you for that. But several years ago, she was back in Cincinnati visiting family when she was forced to visit the VA facility in Cincinnati. And she was not particularly happy with the service that she received there. When she was released to come back home, she told them, you know, you should bring someone back with me to Palo Alto to see how a VA should be run. They didn't like hearing that from her very much. But I just feel so fortunate that we're able to have this wonderful facility here. And I thank Director Freeman for the wonderful job that she's done in organizing it and running it.
Thank you.
Thank you. There's just one minor, very minor issue that in the evenings, the telephone care program is transferred up to San Francisco. And I mean, they can still help with advice and tell you to go into, they may call the emergency room to say you're on your way in or whatever. But when, like if you ask for a same-day appointment for the next day, they do not have access to Palo Alto's system. And if there could be more integration between those systems, it would be a great help.
Thank you, sir.
Thank you.
I do have a comment card I'm going to read here. This is from Mr. Fox. And I think this might be addressed to Mrs. Freeman. The Palo Alto healthcare system needs a state-of-the-art telephone system. Please let us know what is being done about it.
Sure. Thank you, Mr. Fox, for the question. And I think that, you know, if anything good is going to come of this situation in the VA, that perhaps some attention to the separation of the Office of Information and Technology budgets from the medical center. It's now centralized, so it's not even within the Veterans Health Administration. It's a central budget. So we are not allowed, even if we had the money, which we've offered many times, to buy an updated phone switch that would address the gentleman that was just speaking and address this question as well. And I think that's number one on the VA's radar right now is getting a new scheduling system. That is already underway. And I think number two is going to be a 21st century phone system, state-of-the-art phone system, so that the drop calls, just the inability to properly manage that a lot of you have experienced, the frustration you've experienced, I really think that we're going to see some improvement on that very shortly.
Can I ask a question, Lisa? I've been told that you are so hamstrung in terms of your ability to purchase equipment that you can't even go out and purchase a printer at the local Fry's, that you have to go through some elaborate system. Is that true?
That is correct, because it's all part of that IT budget that is separate and separate authorities. And you know, there's you know, we want to reduce variability, but I don't know that centralization achieves that goal as much as just some, you know, some common sense delegation of authority at the local level. That I think we should be, you know, we always regret that we're almost we're a $900 million healthcare system. We can't go to Fry's to buy a printer that's needed for timely care to be delivered in different parts of the healthcare system. So that's absolutely correct.
What was the purpose of the centralization? Interoperability with other facilities? Do you need that?
I think that, you know, there's overreaching on accountability, that there is a centralized way they can track every single IT purchase. So there's an IT tracker. And then, quite frankly, I think, you know, sometimes the VA will overreach as far as accountability on who has authority to do what. So, you know, this centralization is an attempt to know who is accountable and keep these really clear lines of authority. But then, you know, we joke sometimes on information security, the same thing, that we are so secure no one can get any information out of us. So, you know, you have to have a balance, and we'd like to see more of a balance.
Thank you. We'll take a question.
Hi, my name is Steve. I'm not a veteran. My father, 90-year-old father, is a veteran of World War II in Europe. I'm speaking in general for VA, because my dad has had very good care here for the short time he's been coming here.
and that is communication to the vets, either the 90-year-old vets like my father or the new vets who are coming over from Afghanistan. And that is, I know through my father, they don't like talking about what happened in the service. You know, my mother didn't hear things for years afterwards. I didn't know my dad won a Bronze Star until he told one of my kids. And so they're very proud. They think they can take care of themselves. And they're not aware of all the services offered by the VA. And I have never seen an effort by the VA to let the veterans, whether they're the older veterans or the new veterans, know of all the things that are available for them. My dad's he lost some hearing in the Battle of the Bulge, and for years we told him, he would say, "I'm just ignoring you," like he always used to say. But I suggested go to the VA, and he says, "Oh no, they don't cover things like that." Not until one of his people who he knew of his age told him that she was going there. So he went at the age of 78 to start getting his hearing aids. In the meantime, 20, 25 years, he'd been paying thousands of dollars for hearing aids, going to the Palo Alto clinic. And one of the things is that when you have people going to these outside clinics, they're not going to tell the vet to go to the VA. They want the money. And so you have to do a better job of informing people what is available for them to do. I mean, my he's getting his eyeglasses now there, but I think that's a really big thing. Also, recently you sent out a questionnaire, Ambulatory Care 2014. It's a rather long form. A lot of the vets have reading problems, hearing problems, cognitive problems, problems of just being able to handle stuff because of what they've been through. And this isn't really very good. I mean, it's fairly long. Some of them might not understand it. My dad's lucky he has me and my brother around so we can help him with it. I think when you do things like this, you really need to talk to different groups of veterans who have different types of problems to see if they're able to answer this or what they can get out of it. The last thing I'm going to mention is I just talked to the intern my dad, see if she called to find out if he uses a computer. Even though he used to work at Stanford Electronics, he never learned how to use a computer. And I said, just send me the stuff. But anyways, I was saying we need to make an appointment. She says, oh, well, that's changing. And he's been seen in geriatrics, gerontology geriatrics. Say, well, we're changing that now because your dad has a primary care physician outside of the VA. We're going to handle it differently. And she couldn't tell me more because she really didn't understand, and she said she'd have one of the doctors, somebody else, call me back. But the fact that someone has a primary doctor outside the VA should not preclude a veteran from getting the full services from serving their country that they deserve. And I would really like that looked into, and I'd like to find out more about that. Because he's been treating very well in geriatrics, and actually at the Palo Alto Clinic, Dr. Chang, who used to be here in geriatrics, told us, I want you to go to the VA for geriatrics because they're 30 years ahead of the Palo Alto Clinic. So I really think that these veterans need to know what is offered to them. And then it's sort of scary is if it's such a backlog in places now, what's going to happen once all these guys are aware of it, men and women are aware of it. Thank you very much.
Thank you, sir. Okay, in the essence of time,
would you like me to answer a couple of those questions? So, sir, we'd really love to have you get with one of the staff and someone could just raise their hand. They can help you out with your dad. But just a couple of things on the advertising. So on the PR, I completely agree. We could do a much better job of advertising what the VA offers and who it offers it to. I've had the same experience with both my uncles, are both one a former prisoner of war, both World War II veterans that just thought the VA is for people, anybody but them. And that's what all of us try to do. It's what I do in my personal life. Anyone who I encounter is a veteran or knows a veteran. I said, please come to the VA. You've earned the service. We owe it to you. We have an outreach team. We could do a better job in the communication. We absolutely acknowledge that.
Is there a brochure that lists all the services? Sure.
We have a beautiful website. So I always encourage folks to go to the web. We have beautiful access folders that have all the different kinds of services. We always promote what's offered through VBA and other parts of the VA as well.
Lisa, how about doing an interview by phone rather than by a survey. Have you considered that, and is the cost
So
prohibitive?
I believe what, and thank you for bringing that up, because I believe what the gentleman was holding is one of the national ambulatory care surveys, and we have found those surveys, as you say, to be so long and so difficult for many of our veterans to understand, much less complete. I think I see Linda Frommer is here. If Linda would raise her hand. So Linda heads up an effort we started here a number of years ago, our Veteran and Family Advisory Council. We don't put out anything to veterans locally that we don't already review with that Veteran and Family Advisory Council to make it more legible, to make it more meaningful. And that includes something that we do proactively here called Truth Point, tablet-based technology, just a couple of questions. We preview those questions with that Veteran and Family Advisory Council so that we can get real-time information and act on it quickly, not wait 6 months or however long it's going to take national office to get that survey information back to us. But all very good points that you raised. Thank you.
Thank you. So as I was saying, in the essence of time, if you can make your questions very succinct and short, and then we'll get as many people as we can here. Mike, want to let that next gentleman?
This is a question directed primarily to the Congresswomen. Right now, we have military people in Iraq, and this is without authorization by Congress. There will be more people, both people who are wounded and who are suffering from traumatic stress disorder, and they will be coming back into this system. So the question is, first, are you ready to impeach this president?
All right, sir, I am happy to respond to your questions. I think because of the time that we have, we want to focus on the VA health system right now. I'll be happy to answer your question after we conclude the program and handle it that way. But no, I do not support the impeachment of the president.
Yeah. Let me just add something to that, sir. There are very few members of Congress since our country was born that have had the following two votes to cast. A vote on war and a vote on impeachment. That came on my watch. Both of those came on my watch. And when you take your oath of office, you don't know what's going to be part of your watch. I can tell you that impeachment tore the country apart. And so I don't support that. I don't think there are grounds for it. I think we need to get back to what the subject of the matter is today here at the Palo Alto VA. Thank you for coming.
Thank you. Would you stand up, the next gentleman?
Good afternoon, ladies. My name is Herbert Chappelle, and I'm from HBRP over there in Menlo Park. And I have two things for you. First, how come it takes the VA to process PTSD cases from the Vietnam era? Okay, I'm from the Vietnam era. And my other question is, how are the vets that's coming back from these wars in Iraq and these other places that we're fighting in today able to get their cases taken care of on top as soon as they get home? And people like myself, I'm 62, and I've been waiting something like maybe 30, 35 years to try to get some answers for this, and it kind of makes me feel like we've been forgotten about. I've even tried to commit suicide a couple of times, you know, because I thought the government had given up on us, you know. So, you know, I'd like to get some clarification on that if possible.
So we do have a VBA representative here. Mr. Deloney is here, and I think he'd be happy to speak with you about your individual claim and talk with you about, there's a lot of information that could be shared about special processes that go on for our newest returning service members on expediting their claims that he could share.
But he's talking about being a Vietnam vet, though.
Oh,
Menlo Park.
and Vietnam as well. I mean, your individual claim, he could talk with you about that as well.
But have you not been able to access PTSD health care?
Yes, I have, and it was some years ago, and I haven't gotten any answer. I even still have the paperwork, you know, to as well, filled out. You know, and that was about 12, 13, 14 years ago, and I still have the paperwork. And it all started right here. Now, I guess they were doing some kind of experimentation on who, you know, for people with PTSD in that era that was, you know, coming out.
Are you getting care today?
With PTSD?
Are you receiving the care that you need today?
I'm not clear on what you're asking.
You're in the HVRP program now,
yes,
correct?
So that's the program.
So he's enrolled and receiving care right now.
Yes. Oh, I'm getting a good, beautiful services there, but I'm just, you know, wondering about this other thing that I was questioning about. How are they able to do it? They're getting their services quicker than people that like.
So your question is, why is it returning Afghanistan and Iraqi war veterans are getting access to services quicker than Vietnam veterans?
Perhaps claims.
Veterans.
He's asking about claims.
He's asking about claims. I think
are you talking about disability claims or about health care?
Just claims in general. I mean, you know, for whatever, you know, what happened during that Vietnam era time for disabled vets, you know, now they'll be getting the services that they're giving the returning vets from the wars that's going on.
And I think you're talking about the difference in the prioritization that occurs in VBA. And again, Mr. Deloney is happy to talk through that with you.
Thank you so much, sir. Thank you.
Okay, thank you.
The next question I have is from a cue card here, and I think might be directed to all three. The Palo Alto healthcare system and VA needs a state-of-the-art scheduling software package. Do you have any ideas on how we might be able to go forward with that?
So just so everyone's clear, it's not a question, again, of forwarding it. It's that it's a national system and a national package. And this, you know, fortunately or unfortunately, this current crisis, they have procured a new scheduling package, and we're just starting to learn a little bit more about it. And that we should see some effects of it in the coming fiscal year. So starting some phasing of it in October of 2014.
Are you happy with it, Lisa?
Well, the current system is...
Anything's better than the current system.
Yeah, the current system, anything is going to be better than the current system that is quite old. Yes, ma'am.
Next question.
Mike, next person.
I have someone with mobility issues right here, so these guys graciously allowed her to go ahead of them.
Thank you very much. Good afternoon, I'm glad you're here. My name is Sandra O'Neill, and I'm a veteran nurse from the Navy. I like to tell people I'm a Marine Corps nurse. That always gets them to pay attention. I became a patient here in 2006. And I've had 3 hip replacements. Can everybody count that? And I've gotten just excellent quality care and timely care. And I'm especially happy that they have a special women's veterans center. And I believe that this medical center pioneered that concept and made it available to women veterans. So the other thing I'd like to compliment this Veterans Center for is the security division. I live close by, and I come and drop in the outpatient physical therapy clinic when I can, because they have a special bicycle there that I like. One time I was there when I saw a man veteran who I didn't even know was a veteran, but I'd had a social relationship with 20 years ago, and at that time had to get a restraining order against him. There we were both in the clinic. And it frightened me, and he left rapidly. So I called Linda Kleisner's center, and she took me right to the chief of police here, and he said, we'll do what we can. And I told the people in physical therapy, and they said, well, just to make sure you're not here on the same day. And I think that's really exceptional beyond Call of Duty kind of care that I've gotten here. And my only complaint is that many times in the clinic when they come to call me for my appointment and put me in an exam room, they call me Mr. or Sir. And if that's it, I'll never pass the physical. So that's my only complaint. I've gotten wonderful care here, but I thank you for your interest in everybody's contribution.
Thank you, ma'am.